Hi, I'm Kevin Boyd, the CIO at the University of Chicago, and welcome to our video series on generative AI. I'm very pleased to welcome today Samuel Wolschenbaum, a doctor and professor at the University of Chicago. Sam is a professor of pediatrics and the Associate Chief Research Informatics Officer for the University of Chicago Biological Sciences Division. And Sam's clinical specialty is pediatric oncology, which is caring for kids with cancer. So very pleased to have you here with me today.
Great, thanks Kevin.
So we're talking about generative AI and artificial intelligence in general. And I'm really interested in the implications of this for healthcare. Let's start somewhat generally and talk about the evolution of AI in healthcare and what's really sparked its use and rise in recent years.
Yeah, people think AI is like this brand new thing that has just sort of exploded, but these tools have been around for 40, 50 years. The first computer system to detect appendicitis was in the UK in the early 70s. And they had a really cool algorithm that would help detect whether somebody needed to go to surgery or not based on their symptoms. And I think it's a really cool case because when they tried to move the algorithm to another institution, it didn't work. And I think that really is exemplary for what we deal with today when we think about generalizing these complex AI algorithms. But these things have been around a long time, and you know, throughout the 70s and 80s and 90s, these things just got more and more powerful, helping predict things in the hospital, but also helping with clinical decision support. What's happened over the last few years, of course, is the rise in computing power and the ability to do these things so quickly has really led to an explosion in our ability to do things like predictive algorithms all the way down to better decision support, and it's only going to increase.
Interesting. So what are the key applications that you would say are making the biggest difference with AI in healthcare today?
Yeah, I think what I see it as is we're really freeing up the physicians to do more with their brain. So, you know, some of the cool things in the clinic are like these new listening applications that will listen to a conversation or even an exam and will automatically write the notes for the clinician. That would have been unheard of a couple of years ago because the AI just wasn't quick enough to do those sorts of things. Having AI helped predict which patients are going to get sick. So how do you know which patients in the hospital are more likely to have a cardiac arrest? You know, we have algorithms that are now running continually to do these kinds of predictions. Even things on the billing side, so helping generate better codes for different things that we bill for. All these things are just taking off now because we finally have computers, algorithms that are fast enough and smart enough to really help the clinicians get their job done better.
That's really interesting. So as we're seeing more use of it, are there some challenges? Are there some things that we should be thinking about with, let's say, data privacy and other things like that?
Yeah, I think there's always worries about the data that we use to feed these algorithms and where they go. And a lot of these algorithms, as you know, are being run on cloud-based servers by other companies. And if we're not careful and physicians and other clinicians aren't cognizant of what they're doing, they could inadvertently feed important private information into some of these algorithms. So it's really important that institutions like ours think about this, make sure that the resources are available locally for clinicians to use safely, but also to educate and train so that people understand how to use these algorithms responsibly so that patient privacy can be maintained.
Okay. Feeding on that, let's talk a little bit about the ethical implications. So as I was preparing for this, I was researching a little bit about some of the uses of AI, particularly in radiology, and some of the things that AI can detect and see, but there were also some interesting bias implications. Mm-hmm. Let's talk about some of the ethical implications.
Yeah, if you think about the whole spectrum of how we use these tools, there's how do we develop the tool, so how do we source the data, and for, you know, I think it's a real concern that a lot of our predictive algorithms might just be trained on wealthy Caucasians, right? And so how can you generalize that algorithm to somewhere else? And I mentioned, you know, the early 70s in Leeds in the UK, the whole reason they couldn't move that algorithm to another hospital was trained on a very specific population. So as we build these algorithms, we have to be thinking about what goes into training them. And then the same is true for how we apply them, because we want to make sure that the application of these algorithms is done in a way that allows access by the entire diverse community and making sure that we're applying it equally across communities. I think these are really important questions. I know the NIH is thinking about this because all of the recent grants have a lot to say about the ethical use of AI and how you're going to be thinking about AI at each step of the application process.
And I'm going to ask you to say just a little bit more about what we mean when we talk about training it on a specific population. Like how does that have implications for the ethics in the healthcare?
Right. So if you're going to have an algorithm, say, that predicts who's going to have an asthma attack, and you bring in data that are only on patients of a certain population. Let's say most of your patients are, white patients from the north side of Chicago. Mm-hmm. And you train that algorithm may be picking up on very specific things that are biased toward their race and ethnicity. And when you try to go use that algorithm in a population that, say, is African American, it may not work as well, because race and ethnicity are proxies for underlying genetic and genomic factors that we just don't understand. So you might try to use it in another population, it just wouldn't work as well. It could actually be dangerous if you don't apply it in the right way. So the ethical thing to do is to not only make sure you're applying it ethically, but to work with the community, to educate, to make sure people understand how these things are being used. You can't just have these black box tools and apply them. The patients have to be part of the conversation and understand how you're using them.
Let me flip it a little bit. Are we seeing some cases where the use of AI actually levels the playing field for different populations?
That's an interesting question. I would think that having access to some of these new tools could certainly make it easier for other populations that may have not had access in the past to actually get access to healthcare. So like I mentioned, this note writing tool, that's really going to really change. I think it's really going to positively impact the kinds of care we can deliver if we can administer that tool over a larger population. It allows us to collect data in ways that we couldn't before. So we all of a sudden can parse or to get information out of these notes that have been so hard to get at before with these new large language model tools. So these types of AI tools will allow us to study these populations in greater detail. It will allow us to collect better data on race and ethnicity in ways that we couldn't before. So I'm actually very excited about using these tools to actually help level the playing field and increase the diversity and equity in our healthcare.
That's really interesting. Looking to the future, what do you think are going to be some of the most significant developments? And I know I'm asking you to peer into the crystal ball a little bit, but what do you think might be coming with AI and healthcare?
So first of all, I think the information that's in somebody's medical record has traditionally seemed very locked down. And I think we're moving into a period now where we're going to be giving more and more control of data back to the patient. And I think AI tools are going to help us give that control back to the patient. They're going to help us extract meaning from the medical records so that the patient can understand. It's going to help us devise better ways to do consent, where we can have patients control the movement of their own data, where they can decide who they want to see it and when. So I think the days of thinking of the EHR, the electronic health record, as sort of like a lockdown thing, I think those days are going to come to an end. I think AI is going to help with that. Plus, as you're aware, and as I'm sure everybody's been talking about, there's so many new tools now about radiology diagnosis, about pathology diagnosis. And as with any new tool, the first reaction is it's going to put the doctors out of business. And of course, that's not happening. It's never happened in the past. It really just frees up the doctors to do more cool things. Echocardiograms didn't put cardiologists out of business. It just allowed cardiologists to think about other more exciting things. And I think we're going to see the same thing with these really cool new AI tools, where if you don't have to write your notes for 20 minutes, you could be seeing the next patient. So I think it's a really exciting time.
So let me build on that answer. If you're a medical student today or an intern in a hospital, what are things you should be doing to prepare for the AI of the future, of what's coming?
Yeah, I've been saying this for years. It's sort of like the old Graduate movie, Plastics. I think data is the thing now, and I think any student should really be thinking, no matter what stage of their training, how can I understand data better? Because these tools are going to become more and more black box algorithms, and the ability to understand how the tool is developed and used, and your ability to explain it to a patient, I think is going to be really critical. And if we don't train clinicians to understand even the most basic concepts of machine learning or deep learning, I think we're really doing a disservice to our patient community. So I would advise anybody who's being trained to take the time to think about ways to get better trained in basic data science.
We touched a little bit on equity. Are there things that you think we should be doing as a university community, as an AI community, to help make AI in healthcare more equitable going forward?
Absolutely. I think this is a critical moment, and I think University of Chicago is at a critical geographic location to really do this well. And so as we think about these tools, we really have to involve the community. And so one of the things that we've been doing as part of our Institute for Translational Medicine is convening community interest groups and community groups to talk about these tools and what's coming. I think the community has to have a say in how these are going to be implemented and used. If somebody comes in and you say, hey, our algorithm says you need this chemotherapy, they deserve to understand why. And the community deserves to have had some input into how these tools are going to be used in the community. And I think the involvement of as many groups, as many stakeholders as possible is always a good thing.
That makes a lot of sense. Let me ask you personally, what excites you most about the future of AI in healthcare?
Yeah, for me, as a researcher, I'm just so excited about our ability to extract better information from electronic health records. As you know, electronic health records were designed to help with billing, and they're not great research tools. And so much of the most important information is buried in really old-fashioned style notes. And AI, especially large language models now, are allowing us to get at the meaning of what's in those notes in a way that we never could before, to take those data, put them into data commons, and to really build and understand what's going on with the patient. So to me, the most exciting part is just getting better and better data to study.
Interesting. Okay. So a lot of focus on data, and we've heard that from some of the other segments that we've talked about. It seems like the data is really the key to making the AI successful.
You need good, clean, well-curated data. And I think one thing we've seen over and over again is that, as you know, if the data are really poor going in, you're going to get poor results unless you have such an overwhelming amount of data, it's going to wash it out. But that's not the case. For some of these rare diseases, we have a precious little amount of data, and so it needs to be really clean and good. So we've been working hard to come up with better ways to curate and get really good, clean data from not just locally, but internationally.
Interesting. So to close this out, I'm really curious about your perspective. Do you think AI is going to revolutionize healthcare, as some have suggested, or is this just another tool in the tool bag for doctors?
I mean, so I'll take a long way around to that answer to say that there's always going to be shiny objects that people get excited about. And if you go to any of these industry meetings, you'll see one startup after the other with the newest, greatest, incredible tool to make your life better as a clinician or a researcher. But the old standards still apply. You have to figure out what you need. You have to figure out what is out there to help solve your need, and you have to put something in place that's going to help you, and you have to understand it. And so I think it behooves us as healthcare providers to really think about what problem we're trying to solve, that we shouldn't just put something in because it's cool and shiny and they gave us a good deal on it. So I think that's really important. I'm just so excited. For me, I'm just so excited about the ability to leverage these tools in all aspects of care, whether it's a patient hitting the parking lot and getting a text message that their CT scan is late and they should go somewhere else, all the way down to taking a pathology note and finding out the cool information in there. It's never been such an exciting, incredible time that I've experienced in the last 25 years. So I'm optimistic that this is an explosion, but I'm thinking of it positively.
That's great. All right. Well, I'm excited about the future of AI in healthcare.
Yeah, me too.
All right. Well, Dr. Sam Volschenbaum, thank you so much for joining me today. I really appreciate this.
Yeah.
This was an interesting discussion.
Great. Thanks, Kevin.
All right. And thank you for joining us for this segment of the University of Chicago's series on generative AI. I'm Kevin Boyd, the CIO of the university, and I appreciate you joining us. Thank you.